The pioneering NGOs in Bali have been at the forefront of the response to the HIV epidemic in Indonesia since the early 1990s. Engaged in both advocacy and the community response, they work with men who have sex with men and transgenders, sex workers and their clients, and support groups of people living with HIV. The field workers, including the ones in this film, develop strong, trusting relationships with the people they reach and provide support, education, referrals for clinical services, condoms, and for injecting drug users, needles and syringes. They have been responsible for bringing about significant behavior change as well as social change in the communities where they work. Dua Hati works with injecting drug users in communities ranging from those in prime tourist destinations like Kuta and Ubud and urban Denpasar to remote villages. The IDUs tend to group by their interests. In Kuta and Legian on the coast, quite a few are part of the serving community, where outreach workers meet them. Dua Hati outreach workers are local and may belong to the communities they work with, so they readily access and understand their clients and build trust. For example, in the Ubud area, this outreach worker identifies safe houses for his clients who prefer to avoid government clinics. The camaraderie with which he is greeted and the relaxed atmosphere in which the discussions take place clearly indicate the trust these users have in him. Dua Hati's needle and syringe distribution and clinical referral service have reached far into the various injecting drug use communities, which are otherwise inaccessible, and through collaboration with Dua Hati, the community health centers can now provide clinical services to IDU. The outreach workers have earned health workers' respect and have become an invaluable resource for them. An example of excellent synergy between the outreach programs and government services is a local government community health clinic in Kuta, where healthcare providers in the methadone clinic are at ease with their clients and their clients display open trust in the staff in return. The outreach workers monitor their clients and they have regular support group meetings in the car park of the clinic. The clinic has become a haven where the IDU are at ease and can discuss their problems with drug use. In 2013, Dua Hati's outreach workers reached over 800 IDUs, nearly all the IDUs in Bali. Casual sexual encounters are part of IDU's lifestyle, so Dua Hati outreach workers' promotion and distribution of condoms are very important. It is important to put this all into a historic context. When Dua Hati was established, professionals were apprehensive about large numbers of HIV-positive IDU in Bali without services. It is gratifying to see now that there is less stigma and risky behavior and comprehensive services available for IDU. This bears testimony to the value of sustained outreach programs manned by credible, professional outreach workers. While Gaya Dewata focuses on various gay and transvestite communities in Bali, its primary focus is on urban men who have sex with men, or MSM, who identify as gay and those who do not. Although there is overlap between the various communities, there are distinct differences dictated by location. In the urban areas, Gaya Dewata workers reach out to young local MSMs who, new on the scene, are uninformed about the risks of unprotected sex. Often, this lack of information is linked to the fear of social discrimination, as they have not come out. In a park in Denpasar, sensitive outreach workers are able to talk with their younger, shyer clients in the relative security of the night. A key part of the picture for Gaya Dewata is commercial MSM sex. In 2013, they reached 260 MSM sex workers and 1,000 plus of their clients. The MSM sex worker scene includes the popular resort areas of Kuta and Seminyak, where it's all about nightlife and the bar scene for openly gay men, other MSM, and transgenders. Gaya Dewata outreach workers are regulars, relied upon by these freewheeling communities as an accepted and appreciated fixture on the strip. The field workers have been very effective at referring men for HIV tests and treatment. Among transgender clients, 40% said they were HIV positive in the last survey. In light of this, it is poignant that the transgender community has joined forces with Gaya Dewata to effectively reach out to rural Balinese society through raising awareness in villages with their highly popular volleyball tournament program. A team of transgender players tours villages and competes with local teams. The players are entertaining and are also tough opponents, which naturally increases their reputation as a draw card. The team and supporting crew spare no effort to take advantage of the events to spread information about HIV and other STIs to the crowds, distributing leaflets and hosting quizzes. Gaya Dewata's programs have had a significant impact in the MSM and transgenders they reach. Gaya Dewata is committed to making sure that they continue to reach as many of the young MSM in Bali as possible to contain the epidemic. Kerti Praja is located in South Denpasar, conveniently close to the main red light districts of the area where they work with female sex workers. Included in the ranks of outreach workers are former female sex workers. Although initially controversial, it is beyond question that these highly motivated women are a crucial part of Kerti Praja's success. Again, it's not simply a matter of access. It is their understanding, street smarts, and empathy that are invaluable in getting their message across. Together with the NGO Citra Usada Indonesia, Kerti Praja reached 5,500 sex workers in 2013. In addition to outreach, Kerti Praja provides full clinical services, including counseling, testing, antiretrovirals, and peer support. Many of these women are being treated at Kerti Praja as well. There are port HIV working groups in Bali's two major ports, the busy fishing port of Benoa in South Bali and the small port of Celukan Bawang in the north. The working groups are a collaboration involving the port clinics, the port administrations, and in Benoa, the Longline Tuna Fishing Association and the Denpasar City AIDS Commission. In 2013, the two programs reached more than 5,500 men. Impressive for such new programs. In both locations, outreach workers and trained cadres are working with highly mobile men, focusing on those who buy sex, quite a few of whom only come into port every few months. In Benoa, working group outreach workers go on board the boats. The boat owners and captains are highly supportive of the program, which includes information campaigns, interactive group discussions, distribution of condoms, and referral for STI and HIV testing and treatment to private and government clinics. The outreach workers also reach men at motorcycle taxi stands and small coffee stalls, where sex workers also gather at night. The port's working group in Celukan Bawang, a cargo port, carry out similar programs to Benoa, and in addition, provides VCT services. The success of these two programs has inspired similar activities elsewhere in Indonesia. Citra Usada Indonesia was one of the first NGOs to work with HIV in Bali and is primarily focused on sex workers and men who buy sex in less developed areas of Bali. A key element of Citra Usada's approach is engagement with the community to generate support and participation and to constantly monitor the ever-changing local sex industry and respond accordingly. There are two crucial aspects to note about Citra Usada's area of work. One is the rural setting, in contrast to the south with rapid urbanization and a high concentration of migrant workers and workers drawn to find jobs in construction in Bali's building boom. The other aspect is that many of the brothel complexes in North Bali have sprung up along the major truck route. In one village, the local sex industry started with one brothel. Now, many families and compounds just off the main road in the village have leased buildings to pimps. Citra Usada's outreach workers, who have deep ties to the local community, have had a lot of success in raising awareness, particularly among men who buy sex. For example, one of the longest-serving outreach workers has successfully spearheaded community-based awareness campaigns that have lifted the taboos on speaking publicly about STIs, condoms, and HIV. The trust that outreach workers and volunteers from within the community have won has had remarkable results on the community level, where people have actively destigmatized HIV, creating a more open flow of information. Local men who receive information from outreach workers quickly share with their peers. Further east, Outreach workers have also worked hard to gain the trust of their clients. Through regular informal contact, they manage to keep up a two-way flow of information with sex workers and their clients, gaining access to new brothels and pimps. In the West, in the Gilimanuk Ferry Harbor, outreach workers have gained the trust and interest of a wide cross-section of harbor workers, from motorcycle taxi operators to security personnel, distributing information and condoms in smaller, informal social gathering places. They focus on broader men's sexual health issues as the key to getting men to discuss matters related to HIV and STIs. Spirit Paramachita engages with community leaders before setting up peer support groups of positive people in a wide network across the island. Many of these groups, mostly in rural areas, have focused on developing a strong degree of self-reliance through setting up small businesses, primarily agricultural. The leader support is crucial in more remote communities where there is often little understanding or information about HIV, and stigmatization can easily flourish if not addressed early. Spirit Paramachita's outreach workers set up links between health workers and their clients, which often creates emotional bonds. In one such case, a 70-year-old nurse in Buleleng risks a trail bike ride up the steep mountains and then walks up a rough trail for 2 kilometers to visit the widow of a farmer who had contracted HIV on a post-harvest spree in the lowlands and then infected his wife, a fairly typical feature of the epidemic in rural Bali. The support groups give hope and support to their members for a productive and meaningful life. Members of one support group write their ambitions on tags and hang them on a wish line outside their meeting place. One of them reads, "Policewoman." Another reads, "Photographer." And yet another, more humbly, says, "Garbage recycler." In Bali and other parts of Indonesia, there is a wide gap between high-risk groups, including those who are HIV positive, and the people in health and related sectors, who are responsible for their care as well as for preventing a wider epidemic. Outreach workers in Bali are bridging that gap to help people at risk and to link them to services. Without the outreach workers, it would be nearly impossible to identify and communicate with individuals in these high-risk groups, let alone teach them to modify their risky behavior. Often coming from marginal sections of society themselves, the outreach workers are perhaps the most unsung of all in this ongoing battle against the spread of HIV. They have first-hand knowledge and access, they are prepped and informed, but most of all, they are deeply committed to their work. The work of these organizations and the compassion and dedication of their outreach workers is essential to containing the HIV epidemic in Bali.